Welcome to ACC 13. I don't have to tell you that it's a time of tremendous change with the practice of cardiology. And, change is inevitable, and I'm joined by two experts who are really doing everything they can to educate us and to really educate our members and educate Congress, I might say, about what's going on,
Exactly.
which is a tough job.
Exactly.
So, Dr. Bill Oetgen, Bill, you're the Senior Vice President for Science and Quality, is that correct?
That's correct.
And Jim Fasules, who's the Senior Vice President of Advocacy.
Yes, sir.
And we were sitting here talking, and I didn't really realize that how closely tied your two missions are. So, Bill, let me start with you. This whole concept, the ACC's put a lot of work into this quality initiative. Are we making a dent? Are we improving quality like we need to?
I think we are, and a very good example of that is the door-to-balloon project that we started about 6 years ago, which greatly reduced the time that it takes for a patient to get the balloon inflated when they come in with an acute MI. So that's a good example. We have other national quality initiatives that we're doing within quality and science. The current one is hospital to home, which is an effort to reduce the readmission rates for patients with MIs and with heart failure. So we have about 1,800 hospitals that are signed up working on that, and about 3,000 individuals across the country. So that's a very active community. And then our next national quality incentive is called SAMI, which is Surviving Acute MI, and it's an effort to lower the acute mortality rate, the 30-day mortality rate for acute MI, using some very interesting techniques that have been discovered with other research.
So Jim, and as I sort of stumbled when I was saying that, but you were telling me really the closeness with which your group works with what Bill's doing.
Totally.
So in the advocacy issue, obviously everybody's crazy about cost and reductions and all that sort of stuff. Tell me about how this sort of intertwines, because there's some interesting things going on.
I think it intertwines in that we could discuss costs and just, woe was me, you're cutting my costs, but what are the alternatives?
Right.
And the alternatives are doing the right thing at the right time, doing something because we should, not because we can. And that ties into the quality measures, the quality tools such as Focus and other tools that help us decide when to do a study, when not to do a study.
And the appropriate use
criteria.
Use,
yeah. And I was going to tie that into also in the choosing wisely, things that we should discuss with the patients about not doing. So when we go up to the Hill, we're actually talking about how the quality measures tie in with the educational process of knowing what you have to get better at and improving the concept and the contents and efficiency. And that resonates, that we're out there improving care and making care more efficient.
Yeah, I mean, it really does. It really ties together. Bill, what do you see as the sort of, you look forward to the big opportunities for the ACC in this whole area of science and quality?
Well, I think the largest part of science and quality are the registries. We have 7 NCDR registries, 6 of them for inpatient conditions or procedures, 1 outpatient registry, the Pinnacle registry. And we're really on the cutting edge of studies, reports that are looking at how medicine is actually practiced today.
Right.
And with that, physicians can use that information, develop quality improvement programs to raise the level of the care that they're providing across many different aspects of clinical cardiology. So that's probably the biggest growth area within science and quality now.
Super. What about in the advocacy area? And also the question I'd have is, how do you get the average member more involved?
Well, I think the average member is very involved, if nothing, by worrying.
They're involved thinking about it.
I think there's a lot of ways to get involved. The chapter. We now are developing sections and councils of interest and being involved in that, so you can work on your interest. We have the Conference, the Legislative Conference every fall. The other thing, of course, is the PAC. The PAC it gets us access to the members of Congress, and getting our message heard is really important.
If you had, it's a tough question. I'll just throw this out. If you had to look ahead 5 years, you know, hopefully we'll still all be here.
Yeah.
Had to look at 5 years. Where do you think your two sort of sections are going to be, or where's the college going to be?
Well, I think the country is moving toward paying for value rather
Absolutely,
than volume, and I think that is inevitable. And what we're trying to do within science and quality, and in conjunction with advocacy and education,
right.
the three divisions are really working hand in hand. We're trying to figure out a way to affect the future, to make it happen in a way that's best for patients and least disruptive for our members.
I think the other thing is we don't know what model is going to be out there.
Right.
and I don't think in the United States we're going to have one model fits all.
No.
So the way we're approaching this is give our members the tools to have highly effective, highly efficient quality care, better outcomes, regardless of the payment system, regardless of the delivery system that they're in. The registries can be used in any delivery system.
Absolutely.
The decision support tools like Focus can be used in any system. The lifelong learning portfolio, all will improve care regardless of where we morph to over the next 5 to 10 years.
You know, it's interesting because I really hadn't thought about it before we had a chance to sit down and talk, is the concept of how these three are really interrelated, and they really do move the process forward. And I think that's a good message for the members to understand.
And I think the success is the door to balloon
stuff.
The other is, if you look at imaging over the last 7 years, especially the last 4, the utilization is going down, and the level of inappropriate studies is going down, and that's the educational process.
So that's tremendous value. Well, I as a member, I appreciate what you all are doing, and for the college, and you know, and it's a painful but an exciting time. I mean, it really is.
Exactly.
And as you emphasize, it's going to be for the better of the patient. So thank you both for joining us, and thank you for joining us here at ACC 13.